Hi everyone, welcome back to our interview series. My name's Alice and today I'm here with obstetrician gynaecologist Dr. Lynn Townsend. I'm going to be asking her a few questions about her life, her career and some advice for us. To begin with, could you share a little bit about your medical journey from uni to where you are today?
So I've done quite a number of jobs in medicine. I didn't get into medicine straight from school, and I did a science degree with an honours year. And then I was fortunate enough to be accepted into the new University of Sydney postgraduate course, and I was part of the first cohort. So when we joined medicine, we all tried to do our little bit, and I worked in a number of jobs in sort of non-doctoring medicine. So I was a blood collector for a long time. And I also worked as an assistant in nursing in a aged care facility, which actually also had a dementia unit. And that was incredibly helpful because it taught me basic nursing skills, how to feed people, how to change them, how to clean them, how to look after them as human beings. And I really enjoyed it. It was the hardest job I've ever done in my life. And then I was an intern at Nepean Hospital, which was an extraordinary experience. My director of clinical training was Dr. Eddie Fisher, who's still around to this day. Eddie was a remarkable man because on our first day of internship, he had a little meeting with each of us and said, "What do you want to do with your life?" And at that stage, I'd already decided I wanted to do obstetrics and gynecology. So he said, "Right, you need to have an ONG term." And as an intern, that was a pretty remarkable thing. One of the reasons why I wanted to do obstetrics. So back when I was doing my undergraduate, I was going to be a neurologist, mostly because I love Olive Sacks and I loved neuroanatomy and neurophysiology. And my undergraduate degree was in physiology. And then I did an honours year looking at visual neurophysiology. And I lined up a PhD. I was going to be a neurologist and it was going to be really fantastic. I couldn't wait. And then I did my ONG term and I had a wonderful registrar by the name of Dr. Amir Hanna, who's based at the Sand Hospital, except I like to call him Dr. Hanna. But anyway, Dr. Hanna sent me off in an antenatal clinic and he said, "Lynn, go and see the patients and then come back and tell me about them." Then he'd open up a well-thumbed copy of New Idea that had been sitting in the waiting room, and he would read the New Idea whilst I went off and did the women's blood pressures and felt their tummies and listened to the heartbeat. And then I came back and presented it to him and he was like, "Yes, that sounds good. That sounds excellent. Good. Okay, now go and do the next one." And I spent that whole clinic going, "Oh my God, these are young, fit, healthy patients. This is so exciting." And literally in that moment, I realized neurology was never going to be for me. I needed to be around young people doing fabulous, normal things. I wanted to use my hands. I wanted to use my brain, and I wanted to be just like Dr. Hanna. You know, mentors make such a difference. I've got one other mentor I'd like to mention, and that's Dr. Karen Mizia, who's my colleague at Ultrasound. Karen is an obstetrician of obstetricians. She is the most technically capable obstetrician I've ever encountered. She is knowledgeable with an encyclopedic knowledge. This year, Karen is the president of Ranscog State Council, the president of ASSAM, which is the Australian Society of Ultrasound in Medicine. She's our medical director at Ultrasound Care. She's the head of MFM at Royal North Shore Hospital. She's an examiner. She's a truly incredible human being, and she taught me so many things going through medicine. I did my first cesarean section with her. Took a very long time. But finding mentors is just like the most important thing that we can do in medicine, because they guide us personally and they guide us professionally, and we need them.
And what has been your most exciting moment as an obstetrician so far?
Well, every single birth is a remarkable, incredible experience. It is such a privilege to be part of people's lives and to be part of their lives at such a critical moment. And I truly love delivering babies, and it doesn't matter how they come out. That's not what's interesting. What's interesting is the relationships with the women and their families, their partners and their other children. And, you know, to be part of that is truly remarkable. My first delivery was as a medical student at Royal North Shore Hospital, and that young man would be 22. And I often think about him, and I think about how his life has played out for him. And I think about the tremendous gift that his mother gave me in allowing me to be part of her most special moment. And one of the real privileges of private practice is being able to develop long-term relationships with my patients and know that in some small way I'm part of their family. And it's such an honor and a privilege. I've seen some pretty incredible things as an obstetrician, though, I must say. One of the highlights of my training was delivering a lady's 16th baby. She had been pregnant 16 times. She had had 15 babies previously and came to the unit that I was working in to deliver her 16th child. And I met every single one of those kids, and I met her partner, which was, he was the father to all of those children. And it was really an unbelievable experience. And I felt that, if I hadn't actually done it myself, I wouldn't necessarily have believed it. But I did, and I was there.
How do you balance what I can imagine is very demanding hours being an obstetrician with all the other aspects of your life?
So, firstly, I have a lovely job in that I can choose my own adventure. And I think that that's one thing that junior doctors don't really understand, is that when you get out the other end, you actually are in control of your life, in the sense that you can choose how you want to work and under which conditions. And my mentor, Dr. Matthew Perez, told me at the beginning of my consultancy to design your perfect week and then work towards your perfect week. So I've got a lot of variety, which provides a lot of excitement. The teaching is a real highlight for me. And I do ultrasound and also clinical obstetrics. But as far as balancing things out, look, I'm very fortunate. I have a tremendous partner who is very happy not to have the academic spotlight on him, and for him to work from home, do the things that he wants to do, and to basically look after our children and run the home. I mean, obviously I'm a contributing member to that household, but it would be extremely difficult to be a 24/7 obstetrician, which I am, and not have a helpful partner at home. And I love my children, and when I have an opportunity, and I make opportunities to spend time with my children, I really like to put 100% into it. But, I'm at work 6 days a week, but I love it. I derive a great amount of enjoyment and satisfaction from what I do.
And we've heard you're quite interested in genetics, and we were wondering, how do you think advances in genetic testing will change the field of obstetrics in the next decade?
Genetics is not going to just alter obstetrics. Genetics is going to alter every single field of medicine. A lot of what we do in medicine for a very long time was a blunt axe. We found a problem and we treated it with what we could and what we knew. But we're beginning to understand that there's a whole heap of stuff that we don't know and that we can learn with time. So, for example, in prenatal diagnostics, which is a lot of what I do in my ultrasound job, but it's the more subtle stuff that's becoming more interesting. And we're able to give families real choices in order to make appropriate decisions for them and to facilitate their children having the best possible life that they can. I would strongly encourage all doctors and all medical students to learn as much as they can about genetics, because it's really the key to personalized medicine. This is truly an exciting time. This is the industrial revolution of medicine.
Do you have any advice for medical students, and in particular for female identifying medical students?
I have a few pieces of advice that I think are worthwhile. The first is pretty basic stuff. We belong to a community of scholars. We have a responsibility to each other, to educate each other, to guide each other, to support each other, to not throw each other under the bus, to really support our colleagues, because we're all trying to do this with a holistic aim. We are here for the patient. The patient is the center of all our discussions. Everything needs to revolve around the patient. Phone your friends. Make sure you've got colleagues in medicine that you can ring up for advice, even if it's so simple and so trivial. It's really not. Having good supports in medicine firstly makes your life a lot easier, because the emotional stresses can be discussed out with people who are actually working in the field. But to ask for clinical advice from people who may have seen it before, I think is extraordinary. This is a tremendous privilege. don't think of yourself as medical students. Think of yourself as doctors at a very early stage of your educational journey. I'm a little bit further along, but I'm no means there. And, you know, even our esteemed professors, they're also not at the end goal. Nobody can know everything about medicine. So if we support each other, we make a commitment to lifelong learning. We make a commitment to learning with our colleagues, to staying abreast of the best information, feeling passionate about the patient's needs. We, you know, will be better in ourselves. And look, to our medical students who identify as female, you know, it's still not an even playing field. And particularly for women of colour, for women who may not be able-bodied, for our homosexual, lesbian, trans women, you know, like it's harder for them, and acknowledging that, you know, they also need a lift up as well. It's, you know, as a white woman, it's important to acknowledge that. So, you know, stay connected, stay caring, and find passion in what you do. Life's too short to live a, you know, unrequited life. So I don't know if you've read his book. It's bloody amazing. It is amazing. It is so good. I met him and I made him sign it for me. And then today he was like, "Oh, Lynn, it was so nice to meet you." And I was like, "Oh, Edwin, it was so good. Kiss, kiss." You know, like I thought, what's he going to do? He's going to say she's a nut job. So what? He can say I'm a nut job anyway. But, you know, I'm going to be who I am. And, you know, a lot of the old, pale, male, stale doctors are going to try and dampen you down. Don't let them. So my maths teacher put me onto Oliver Sacks in year 12, 1992. Were you born? Don't tell me. Don't tell me. Oh my goodness. Like I read this and I thought, this is what I want to do. This is what I want to do. This one is so good. It's called Uncle Tungsten. And it's basically about him up until about the time that he goes to university, I think. Yeah. And then this one is like the second half of his life. And it's really interesting because he came out as an elderly man. I think he was like 70 when he came out. So, you know, like that's incredible. But read these two. These are the two you need to get.
Okay, I'm writing them. I shall
Uncle Tungsten and On the Move.